Hello, let's do another 10 prioritization questions for the NCLEX. So if you are taking the NCLEX soon, you need to watch this entire video. So let's go to questions starting in question 21. So we already answered questions 1 to 10 and questions 11 to 20. So if you haven't seen it yet, go to my channel and watch those two videos. So we're going to start with question number 21. And same principles, things that we're going to do. I'm going to be clocking for 30 seconds. And then we discuss the correct answer, including the rationale. Okay, so let's start with question number 1. A nurse reviews new prescriptions for a client or a patient admitted with suspected epiglottitis. Which prescription should the nurse clarify first? I'm gonna get 30 seconds on the clock right now. And then we're gonna explore the correct answers as well as the incorrect answers and look at why they are correct and incorrect. So when you're ready, log in your answers and then a couple of 5 more seconds, I'm gonna reveal the correct answer. Okay, so can't barely hear that. So the correct answer, just gonna make sure I have that louder. The correct answer here is going to be letter A. Okay. And so we're gonna rationalize why A is the correct answer. So in a patient that is suspected to have an acute, so let me get my pen right, acute epiglottitis, manipulating the throat can trigger sudden airway obstruction. So putting a throat culture, getting a throat culture is not a good idea because it is going to create some triggers and can create airway obstruction. So a throat culture should not be done unless airway is secured. So the airway has to be secured before this is done. And this prescription requires kind of like clarification from the ordering physician. Starting humidified oxygen by face mask. The reason why that is a correct answer, well, that's an appropriate order because humidified oxygen is appropriate to support oxygenation while minimizing agitation. Letter C is also a good answer, like in a sense that that's the thing that you need to do, is because emergency airway equipment. So emergency airway equipment should be available because airway compromise can occur very, very fast. And then letter D is also an appropriate, we don't need clarification for that because having IV access is really very important, especially when the patient is really going to be risk for airway compromise. We can use the IV for fluids, antibiotics, or other urgent treatment. Okay, so letter A is the correct answer for question number 21. So let's go to question number 22. A nurse is caring for a patient with myasthenia gravis who is receiving pyridostigmine 1 hour ago. During the follow-up assessment, the patient is sitting upright in the bed, speaks with a weak voice, and says, I feel like I have more spit in my mouth, and now I'm having trouble swallowing my water. The patient also reports mild abdominal cramping and had 1 loose stool after breakfast. So think about the medication, which finding requires the most immediate nursing action. So I'm gonna set the timer so that I'll give you time to look at the choices. So is it going to be letter A, letter B, letter C, or letter D? Which finding requires the most immediate nursing intervention or nursing action? Okay. Five more seconds. There you go. Okay. So y'all, the correct answer, oops, let me turn that off. The correct answer is letter C, right? So increase salivation with difficulty swallowing. So why is that the best answer? Well, increased salivation and difficulty swallowing raise concerns of airway, right? So this is where airway is a big concern. And it tells us that there is impaired airway protection and increases the risk of aspiration, especially with a patient that has myasthenia gravis. So in patients with myasthenia gravis, this weakness can progress fast and takes priority over any gastrointestinal side effects related to the medication. So let's look at why letter A is incorrect, okay? So letter A is incorrect because abdominal cramping, even though it's mild, can occur with cholinergic medication. So remember, this is a cholinergic drug. Cholinergic drug. So it acts on the parasympathetic nervous system, but so mild cramping can occur, but it's not the most urgent finding as we speak. Letter B is also incorrect, talking about loose stools after breakfast. Remember, loose stool is an expected adverse effect, and there's only one, and does not really outweigh we're talking about airway risk and aspiration risk on choice letter C. And letter D is also an incorrect answer because this one actually talks about teaching. So it's a teaching issue and can be addressed by the nurse after she or he manages the priority problem. So the correct answer, question number 22, is letter C. Okay, how's everybody doing? Okay, so let's look at question number 23. A patient is admitted from the emergency department with bacterial meningitis. The patient is febrile, restless, increasingly difficult to arouse. The nurse notes a blood pressure of 172/58. The heart rate is 50 and irregular respirations. The provider enters several prescriptions. Which prescription should the nurse question first in the setting of bacterial meningitis? I'm gonna put the timer in. Where is everybody from? If you're able to put your location, not exact location, but like kind of like proximity where you are at or what country, put that in the comment section. So question number 23, what is your answer? So time is up. Can you hear that? I hope you can. Okay. So the question is being asked, which order should the nurse question first? And this is in the setting of a bacterial meningitis. Okay. And then of course, as you could see, this is also a clinical sign. The blood pressure is getting higher. The patient is bradycardic, and the patient has irregular uh, respiration. So what do you think it's happening, right? We're thinking of getting increased ICP in here with bacterial meningitis. So which order do you think we need to question? And the correct answer is going to be letter C, right? Letter C is the correct answer because this assessment suggests increasing intracranial pressure. Repeated forceful coughing can further increase ICP and worsen the patient's condition. So this is the question, this is the order that we will question. That's why that's the correct answer. Why is letter A incorrect in this particular scenario? Okay, so actually this is incorrect because this is a good order. Elevating the head of the bed supports venous drainage and is appropriate in patient with increased ICP. Letter B is also an appropriate intervention, especially for increased ICP, because reducing stimuli is appropriate because agitation and excess stimulation can worsen that ICP. And letter D is also an appropriate kind of like intervention because neutral alignment of the head, it says keep the head and the neck in neutral position, it actually supports cerebral venous drainage and is really an appropriate intervention. Okay, so letter C is the correct answer. Let's go to question number 24. A nurse in outpatient clinic listens to several voicemail messages left within the last hour. Which patient should the nurse call first? So I'm gonna get a 30-second here. If you're new, if you can subscribe to this channel so that every time I post new videos on NCLEX prep and nursing school prep, you're gonna get that video. Okay, so 10 seconds to go, and then we're gonna reveal the correct answer. 1 second, there you go. Boom, boom, boom. Okay, so let's turn that off. Okay, so let's figure out the correct answer here. So the question is, which patient should the nurse call back first? So meaning to say which is the priority, right? So the best answer of all the four choices is going to be letter B. So a patient who uses an inhaled corticosteroids and says, my mouth feels sore and I notice white patches on my tongue today. So why is that the correct answer? So remember, sore mouth with white patches suggests tells us that the patient has oral thrush, right? Or what we call candidiasis, right? Which is related to, of course, inhaled corticosteroid. This requires prompt follow-up for treatment and reinforcement about mouth rinsing technique. So why is A incorrect? So letter A, it's saying a patient who started prednisone 3 days ago, I have been feeling much hungrier than usual since starting this medication. So increased appetite is actually common. So increased appetite is very common with steroid use and it's not a priority. Letter C is also not a priority. It says a patient who started severe sulfate last week. My stool looks much darker than it did before. Dark stool is expected for iron therapy, so that's why it's an incorrect choice. And letter D is also incorrect because mild eye redness can occur and is less urgent than suspected oral thrush. So letter B is the correct answer for question number 24. And let's go to question number 25. An RN is caring for a patient on the first post-op day after an open abdominal surgery. The patient is hemodynamically stable, reports incisional discomfort with movement, and has prescription for early ambulation, incentive spirometry, and routine post-operative monitoring. Which task is most appropriate for the RN to delegate to an experienced UAP or an unlicensed assisted personnel? So is it going to be A, is it going to be B, C, or D? Okay. Ten more seconds. 10 more seconds. Which patient can the nurse delegate this to an experienced UAP? And the correct answer is going to be letter B. Assist the patient with ambulation in the hallway. Okay, so assisting a stable patient post-operatively with ambulation is within the scope of practice for UAP. Now, letter A is incorrect. So let's look at why letter A is incorrect. So letter A is incorrect because determining the cause of new confusion, this is the keyword here, requires nursing assessment and clinical judgment. Okay. And then let's look at why letter C is also incorrect. It says evaluate whether, so that's the word, evaluate. Evaluation of a medication's effect is a nursing responsibility. And letter D is also incorrect because it says the word teach. Initial teaching must be done by the nurse. Okay, so the correct answer is going to be letter B. Let's go to 26. A nurse is caring for a patient who is 12 hours post-thyroidectomy. During the assessment, the patient says, "My neck feels tight." The nurse notes frequent swallowing, restless effect, and a small amount of bloody drainage on the back of the dressing. Which action should the nurse take first? So remember, this is thyroidectomy, and this is 12 hours after surgery. I just mentioned that in my TikTok earlier, last night, I think. Okay. So if you follow me on my TikTok account, you will see a topic on thyroidectomy. Okay, 5 more seconds, and let's figure out the correct answer here. So first and foremost, okay, so what do you think is happening, right? We know that the patient is probably having some sort of a bleeding, right? The word tightness, right? And so a small amount of blood drainage at the back. So we know there's probably going to be a lot in there. So the best answer here is going to be letter B. The correct answer for question number 26 is letter B. So think about this. Neck tightness, frequent swallowing, restlessness, and then drainage in the posterior at the back of the neck suggests post-operative bleeding, and it can increase the risk of airway compromise. So the nurse should first support and assess this patient or this airway, right? Why are A's, B, and D incorrect? So A is incorrect because reinforcing the dressing may be needed. Yeah, it's okay, but airway assessment takes priority over dressing change. Letter C is also incorrect because pain treatment does not address the immediate risk of expanding neck hematoma. There is a potential that the patient has neck hematomato, right? And then, of course, letter D, ask the patient to rate the pain from zero. Pain assessment is okay, but the cluster of findings point to a higher priority airway threat in this particular scenario. So letter B is the correct answer. Okay, so let's go to question number 27. A patient, oops, I don't like that color. A patient is admitted with pheochromocytoma and has severe episodic hypertension. The nurse reviews newly entered prescriptions. Which prescription should the nurse question first? 30 seconds. So we're in question 27. So pheochromocytoma, so this is an adrenal gland disorder, right? Especially the medulla, because that's the one that releases epi and norepi. 5 more seconds. Okay, so the correct answer, I don't know why the sound just dropped. Okay, the correct answer is letter A. Okay, so hear me out here, because this is usually what happens. So in pheochromocytoma, I said earlier, beta blocker, which is this one, propranolol, is a beta blocker, should not be started before alpha blockade. Okay, should not be given before alpha blockade because of unopposed alpha stimulation, which can worsen the blood pressure, the vasoconstriction, and trigger severe hypertension. Okay, so that's the question. That's the order that we will question. Why is B a good option, a good order? Because continuous cardiac monitoring is appropriate for a patient that has high catecholamine surges. So in this particular example, it's epi and norepi, right? And then C is also a good thing to do because glucose abnormality can occur in pheochromocytoma. And letter D is also a correct kind of like order because reducing stimuli or stimulation is appropriate because stress can produce or provoke catecholamine release. So the catecholamine or epi and norepi. Okay. Question 27, the correct answer is letter A. Okay. Question number 28. A nurse in an ambulatory clinic returns patient phone messages. Which patient should the nurse call first? 30 seconds on the clock. Again, I would like to ask if you could subscribe to this channel so that you'll get every content that I create to your inboxes. So if you're going to YouTube, you're going to see that. Okay, so I don't know why the sound is like that again. So the correct answer is letter B, right? Well, everybody knows that angioedema is a big concern for patients with angioedema, patients with ACE inhibitors, right? So that would be the first person that we're going to call. Why is A not a good answer? Well, because minor gum bleeding is concerning in a patient with warfarin, but it's less urgent than a possible airway compromise in the form of angioedema, right? Letter C is also incorrect. Leg cramps may suggest electrolyte loss and need follow-up, but they do not outrank airway compromise because we know Lasix can cause hypokalemia, right? Letter D is also incorrect because a metallic taste can occur and it's not a priority, more than likely because patients are taking metformin, okay? 29. Our question, an RN is caring for a patient who is 1 day post-op after bowel resection. The patient is stable, has an NG to low suction, is receiving antibiotic, and is prescribed early ambulation. Which task is most appropriate for an RN to delegate to an experienced UAP? 30 seconds. 30 seconds. So we're going to look at question 29. Which one do you think an unlicensed assistive personnel can take care of in this particular setting? You have 4 settings in there. So, okay, well, I don't know if you can hear that. Okay, so the correct answer is letter A. Okay, so measuring and recording INO can be delegated to a UAP if the patient is stable, right? So measuring NG, it's going to be a UAP role. We say that letter B is incorrect because of the word assess and auscultation, which requires interpretation, right? So that's a nurse's responsibility. Uh, letter B is letter D. Letter C is incorrect because it says determine whether the dressing drainage is the dressing needs to be changed or it's increasing because that's evaluation. And then letter D, the word evaluate there is very nursing function. So the correct answer is letter A. Last question, y'all. A nurse receives morning assessment findings for a group of patients. Which finding requires immediate follow-up? 20 seconds. Thank you very much for those who are following or subscribing. I'm so happy. I'm now 122 followers from last week. So that's really good. Really, really good. Okay. Now that's loud. I don't know why it keeps it. Okay, so the correct answer for question number 30 is going to be letter B, right? So letter B is actually which finding requires immediate follow-up because perioral tingling, so tingling in the mouth, especially perioral tingling, is actually telling us that there is a potential hypocalcemia, right? And in acute pancreatitis, that raises concern because it can cause tetany and laryngospasms. So why is A incorrect, Mundo? Well, A, this finding, so Addison's fatigue and craving for salt foods, fatigue, right? Fatigue. These findings are consistent with Addison's disease, but are not the most urgent in these settings. Letter C says patient with ulcerative cramping, that's expected. And then letter D, patients with iron anemia would have difficulty breathing or dyspnea, hard breathing, climbing the stairs. That's also expected. Okay, so let me put in the comment section what your score is, or put in the comment section what topic you want me to cover next time. I do appreciate it. So again, this is our 10 NCLEX prioritization questions with rationals. Thank you for joining me. You have a good night, good day, good morning, good afternoon, good evening.